ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, welcome back to another episode of Beyond Graduation. I'm Savanah Craig, and with me as always,
I am Ronnetta Sartor.
All right, so this was a request from the one and only David Rice. We're going to be talking about advice and what's the best and worst advice you've ever heard or listened to. I think this is going to be tough, but Renetta's already queued up, so go for it, Ronnetta.
I think that some of the best advice that I got was right out of residency, like as I was leaving residency and going into my associateship. Someone who was about 5 years out, what advice they had for a new resident. And she gave 2 pieces of advice. The first piece of advice was don't take things too personal.
That's really
and
good.
The next piece of advice was don't be overconfident.
Ooh.
Yes. And I think those 2 things, I kept them in mind every day, and it's still pieces that I share with like new dentists. The don't take things too personal definitely came in handy because as a new associate, patients do not know you. It takes time to build rapport and trust.
Mm-hmm.
And by default, they're going to want to see the dentist that's been there forever, that they've known forever.
Yeah.
And so you can't really take that personal. And so I always kept in mind how I am with my doctors.
Yeah.
Like if my doctor isn't there, I want to reschedule.
Yeah.
Yeah. Like I want to see my doctor that knows me and knows my medical history and all the things. And if I cannot, please let me know. Don't surprise me.
Yeah.
And then the second piece about not being overconfident. I think it's a major thing when you've done a residency program like the one we did.
Yeah.
Where you spend a whole year pushing yourself while you have like people holding your hand.
Yeah.
And, now you're going out kind of in the real world and you have to figure out what your limits are really quickly because you may not have someone holding your hand as much as they did in residency.
Yeah.
What about you?
I think those are really awesome pieces of advice. I think, the knowing that you don't need to be everything to everyone and you don't have to be everyone's dentist, I think goes hand in hand with the confidence thing because in residency, we were the buck kind of stopped with us. Yeah. And knowing, I think we've talked with this, just because I can do it doesn't mean I should do it. So finding that piece of balance. And then also just like, if you take good care of your team, they're going to take good care of you. I chalk that one up to my mom, who's a hygienist. And, I worked as a dental assistant at an oral surgery office. And so I've seen, oral surgeons throw instruments at me and at their assistants. And just like, I don't know, I tell my assistants every day, like, you could unplug me from this and plug in another dentist and y'all would keep rolling, but I'm screwed without you guys. Like, and just treating them well and appreciating them and knowing that like we are a team. And yes, I'm in a leadership role and, a lot of the decision-making things are on my shoulders, but I don't like to think of it as like a hierarchy. I don't think I'm better than them or, any of these things. I think we have very different strengths and we need to work in concert. And yeah, like I said, I can't do it without them. So got to take care of them.
Yeah, I think speaking of team, another piece of advice that I received was to praise your team in public. And then if there's any, feedback that might not be so positive, try to do that in private.
Yeah.
Another one as it pertains to that too is like, not to let it build up.
Yes.
If you see something, try to address it really soon so that it doesn't start festering on both ends, like festering within the team.
Yeah.
To destroy the culture, but also festering in you to when you actually address it, it's a big blow up because that's never good for anyone.
Yeah.
What else do you have?
I always think of one of our attendings from residency would always say, you're blessed to have these skills in this profession. Use it to bless others.
I love that.
And I think it puts into perspective on the hardest of days, like, how cool is what we do? You know what I mean? Like,
yeah,
it's super weird, but also super, super cool. And to just like be able to see things with your eyes and then like do it with your hands is crazy.
I guess it's wild to even think about on that level, to be able to do that.
I think about that sometimes, like there are definitely days where I'm just like rolling and you do the thing and you do the motion. And then the other day I had this thought and I was like, I did like my entire dental school requirement worth of work like this week. Like it took me 2 years. You know what I mean? And like, look how far we've come. And then also just the fact that I can be like, there is this bad part of your body part and I'm just going to take it out. And then I'm going to put this like goop in here that I cure with this blue light and then it's all going to be fine. It's so weird. That's so weird, but cool. Like I had a patient who had never been to the dentist, I think was from like a different country. And I was like, okay, so you've got a cavity here, you need a filling. And they were like, what does that mean? And I had to like stop and be like, okay, so like see this on the x-ray, that's like decay.
Yeah.
That's bad. And I was like, it's kind of like a like cancer resection, like tumor type thing where like I got to take the bad part out and clean it and get a clean margin. And then I'm going to put this filling material in here that's not as strong as your natural tooth, but as close as we can do. And we're going to, make it fit just like that part of your tooth was, and it's all going to be fine. And as long as you clean and care for it, it'll last a long time. And they were like, whoa, that's kind of crazy. And I was like, that is kind of crazy.
Yeah, you never really think about it because we just do it on a, daily basis. So
yeah.
That's awesome.
So I don't know, just like look at the little things sometimes, be like, this is actually insane that we can do this.
And I think kind of piggybacking off of that, like some advice that I received too is that you can learn from every experience and you can learn from every person that you come in contact with. Like I remember like being an associate that it would be like some assistants that worked with the other doctor and they would say, well, would you want to try this? This is like what he uses and he really likes this instrument. And then I'm like, sure, let me see.
Absolutely.
Some stuff worked great. And I'm like, oh yeah, I want to use that. And, other things I'm like, yeah, I don't know. It might work better in his hand.
Totally.
But how would I have known had I not, said sure and tried it,
Yeah. And I think that's the other crazy thing when you like step back and like think about like our whole training. I only do what I do because somebody else told me that that's a thing to do. And do you ever think about that? Like I can get kind of down a rabbit hole, but like there were so many things in residency that not necessarily contradicted what I learned in dental school, but like
it was debunked.
Yes. Yes. And you're like, oh, I only knew that because someone else told me. And then
they only knew that because somebody else told them.
Yes. And sometimes that freaks me out. And sometimes it's really cool. And like you're only as good as the information you have, which is cool and scary. I don't know. I can get very existential with that one very quickly.
But it leads to the next piece of advice that I'm sure we both have gotten to always continue learning.
Yeah. Yeah, it's always changing.
I always think about like the discussion you told me you had with your grandparents since, they're aging and their doctors are younger, and you're letting them know that, hey, like, how things were done then and how they're done now is different. But in 5 years, it'll probably be even more different.
Yeah.
And so we have to keep learning. Yeah.
Yeah. All right. What is some bad advice? Maybe not that you were given in particular. I'm trying to now think of like bad things I've seen in like Facebook groups and stuff that
I
maybe
think,
you didn't like take it, but you've seen.
yeah, I think in social media, people will tell you don't own your own practice. They'll tell you don't get married, get a prenup, all kinds of stuff. And I'm sure it's coming from a place of like them looking back on things, but I won't necessarily consider it to be bad advice. I think a lot of that advice might be coming from like, like failed situations or situations that they wish had been done differently. And so if it's not on a like virtual type level, I would always ask more questions. Like I was at CE maybe sometime this year with someone who owned a practice for a while and said she'd never do it again.
Sure.
And so I said, really? What did you not like about it that made you feel that way? And then she started naming things. And then for me, I realized that some of the things that she was naming that started at the beginning of her journey of ownership and even before were not things that rang true for me.
Yeah.
And so there were some things from that discussion that I did take from, and so, again, always learning. And I was like, okay, well, maybe I'll do things a little bit different since, she tried them this way and that sort of thing. What about you?
I think going off of that is being really careful whose advice
Ooh,
you
that's good.
take in. I think it's great to hear things, but only absorbing or being cautious about who is giving you the advice, why they're giving that advice. And especially in the world of social media, like we're getting information all the time and kind of filtering that through. Like, do you want to? I wouldn't take advice from someone whose life you don't want to have. Right? I think and again, I think all advice comes from a good place, but I've had kind of the opposite thing where people telling me that buying into this group practice is a bad idea and I should go out on my own and start my own thing because it could be more profitable in different ways and different. The thing that Adam and I have been talking about a lot is like any scenario is going to have pros and cons, and what works with our lifestyle. And like maybe this isn't going to be the perfect solution forever, but maybe being a solo doc isn't either. I don't know. And just trying to do the best with what you have, and everyone's life is so different. So again, taking that advice with a grain of salt.
And doing your own due diligence too.
Yes.
Yeah.
Yes. So I think even the worst advice has some nuggets in it. I think other interesting advice that you see online, and like you and I have very different practices of like, everyone's got to go out and network with this insurance. And I was at a CE course a while back. It was so interesting because a lot of the people at the course were like significantly older than me by like probably at least 20 years. I was probably the youngest one. And there were a lot of female dentists who immediately like, I don't know, we lady doctors have to stick together, I suppose. But they were having a really hard time in like life and their practices. And so it became really awkward because they were like, don't get married, like all these. And I was like, my husband is great, we're fine. And then they were like, my assistants are the worst. And I was like, my assistants are great. Like it was just everything. And I was like, oh no. And so then they had like gone out of network with all of these insurances, but like, I don't think did it in a very good way. So they were like, they had to like fire their associates and like all of these things. And they were like, but like on Facebook, everybody told me to do these things. I'm like, maybe you should have looked if that worked for you. And then I was like, well, my practice is in network with literally everything and we're doing fine. And they were like, and I was like, everything I say is bad. And so I was like, I'm just going to go have dinner with myself and my Kindle. But yeah, so I think it's not black and white, and you can't just like go to a Facebook group that's like, everyone needs to go out and network, and it doesn't work for everybody.
Yeah, and I mean, it's pros and cons even to that. Like,
Yeah.
During an economic slowdown, pretty much your office is going to be impacted, but it may be less impacted than mine is.
And impacted in different ways.
Exactly, 100%.
Yeah.
Because it's not that you guys aren't having some sort of complication. It might just be that your pain point is different than mine, but it doesn't mean that it's any less of a pain point,
Totally.
Yeah.
And same thing, your ownership of your practice works for you and your lifestyle, but there are still good and bad things. And me buying in a piece of a group practice works for me and my lifestyle as far as I can tell.
Yeah.
And there's still going to be good and bad things.
No matter what we do in life.
No, exactly. Mm-hmm. Exactly. I'm trying to think of some other... Yeah, I think bringing up the point of like marriage and stuff is so interesting because I don't know. I would love to talk to like physicians and know if like they get that same advice. But for some reason, I think because dentists are small business owners and like obviously divorce and things like that impact your business. I think dentists get a lot more advice about
marriage
and relationships.
Yeah, that's an interesting point. I don't think I've ever thought about it that way.
Yeah, so I don't know. If you're a physician out there, are people telling you not to get married? But no, like, I mean, we've had to have this conversation, especially like going into this group partnership. Odds of all of our, I hope all of our marriages work out. But it is an added level of, if they don't, how does that affect the business?
And your partners.
Partners, exactly. So there are like very intentional contingencies in the partnership agreement of like what that looks like, which is just super fascinating and things I had never thought about. Or like if a partner dies, there are contingencies that your spouse gets your shares, but doesn't get your voting rights, so that, Adam can't go sell the business if something happened to me, but he would
just change everything up.
Yeah. He can't go fire everybody and destroy the business, but my family's not going to be screwed if something happened to me. So just the things to think about are weird.
Very true. Well, this has been great. I am so looking forward to hearing what you all have to say out there about the best and worst pieces of advice that you've received about dentistry or about life in general. So definitely comment and let us know what you think.
We'll see you next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.